Hi, my name is Lana Scott, and I will be presenting on diabetes. To understand diabetes, you need to have some background. Diabetes is a lifelong chronic disorder in which the body does not use food properly for energy. In addition, the estimated total cost of diagnosed cases of diabetes increased from 26% from $245 billion in 2012 to $327 billion in 2027, according to the American Diabetes Association. The majority of the food we eat turns into glucose, or sugar, that is to be used for the body's cells. Insulin is the hormone that plays an important part in moving glucose from the circulatory system into the body's cells to be used as energy. Diabetes occurs when the body does not produce enough insulin, or if the body is unable to use the insulin it produces, which results in too much glucose building up in the blood, according to Kaiser. Diabetes is a chronic disease that is reaching its way to the top of being one of the main causes of health-related deaths. To understand the cost of living with diabetes, you must first understand the disease. There are two types of diabetes, type 1, which is insulin dependent, and type 2, which is insulin resistant. Both types result in high levels of sugar in the blood, but type 1 is the least common and occurs usually in people under the age of 30. A person suffering from type 1 diabetes cannot make insulin or enough insulin for the body to properly function. Type 2 is the most common form of diabetes and involves the body's inability to use the insulin it produces. Type 2 diabetes commonly affects individuals over the age of 30 and some children as well. Most type 2 diabetes patients have problems with high cholesterol and high blood pressure, all according to Kaiser. Possible causes for type 1 diabetes that are being studied currently are family history/genetic tendencies, the virus theory, and autoimmune theory. The virus theory applies to diabetes in that some of the proteins that may be contained in the virus are said to mimic insulin. As for the autoimmune theory, diabetes is an autoimmune disorder that destroys insulin-producing cells in the pancreas, whether they are able to produce pancreas or allow the body to use the insulin that has been produced. Possible causes or risk factors for type 2 diabetes include family history of diabetes, age 30 or older, race and ethnicity, overweight, lack of exercise, certain medications, delivery of a baby weighing more than 9 pounds, and gestational diabetes. Gestational diabetes occurs in women when their blood sugar levels increase due to the stress or hormone changes during pregnancy. Gestational diabetes goes away after childbirth, but attributes 30 to 50% risk of developing type 2 diabetes later on in life. A person is classified as pre-diabetic when their blood sugar levels are abnormally high, but not high enough to fully be considered diabetic. Diabetes is important to public health partially because of the expenses that are required to maintain the disease, as well as the rates at which different people are affected. A research study, Economic Costs of Diabetes in the U.S., in 2017 included the following statistical information that illustrates the $237 billion in costs for health/medical resources and the overall $90 billion in cost due to lost productivity related to diabetes in 2017, according to the American Diabetes Association. Majority of medical costs were for inpatient care, medications, anti-diabetic agents, and diabetes supplies, and also physician visits. The average medical cost for an individual with diabetes is 2.3 times more than that of someone without diabetes. Factors associated with the loss of production cost include increased absenteeism, so that includes missing work days to go on doctor visits. Decreased productivity while at work is at 26.9 billion. Decreased productivity for non-workforce, 2.3 billion. Disease-related disability, 37.5 billion. And lost productivity due to early death, 19.9 billion, according to the American Diabetes Association. Type 2 diabetes accounts for 90% to 95% of all diabetic cases. And as for those at risk, the prevalence diagnosed diabetes are detailed by race, ethnicity, education level, and sex among adults aged 18 years or older in the U.S. When looking at those most affected, Hispanics and Blacks have the highest percentages, with approximately 36.6% of Blacks are aware of prediabetes, where non-Hispanics were 15.1% aware. Also, when looking at those that would be most affected, there seems to be a trend that those with higher education levels are at lower risk than those with a limited education. Of the 37.2% of prediabetes with less than high school education, 8.7% were aware of prediabetes compared to the 31% of prediabetics with more than a high school education, and 15% of them were aware of prediabetes, according to the CDCP. Of the 37.4% of prediabetic men, only 10.3% of them were aware of prediabetes, and for 29.2% of prediabetic women, only 17.5% were aware of prediabetes. So in turn, that meant that these people were unaware of the symptoms that would lead someone to be on the lookout for diabetes to be an upcoming illness for them, compared to those who are able to identify symptoms and basically catch it at an early stage. So, as for what has been done to improve diabetes and improve the living for those living with diabetes, the Center for Disease Control, so the CDC, has been attempting to improve the diabetic epidemic by identifying individuals with prediabetes, preventing type 2 diabetes and diabetes complications for people that could possibly be at a higher predisposition for diabetes. The National Diabetes Prevention Program offers affordable lifestyle change program for individuals either with prediabetes or that are approaching it to learn how to reduce the risk of becoming type 2 diabetics by as much as 58 and 71% for individuals over the age of 60. The American Diabetes Association and the American Medical Association created the first national public service advertising campaign about diabetes. And what they did here was basically create awareness and allow the public to be able to understand the disease better and educate themselves. In an effort to reduce costs, states are working with the CDC to assure access to diabetic self-management, education, and support. So in a way, just creating additional resources for patients and other people of the public to be educated on diabetes. And so to wrap everything up, just a quick reiteration that diabetes is a chronic autoimmune disease that essentially disrupts the body from the inside and can have an effect on the patient externally. In severe cases of diabetes, changes to the body can be unpredictable and, if left unmanaged, can be deadly. Diabetes is a public health concern because although it is non-transmissible, it is still chronic, and diabetes that affects millions of people nationally and additionally has an expensive effects on the healthcare system, whether that's providing care for the patients, medication, and other services for them. It would be in the best interest of the public to treat diabetes and possible causes like eating and exercise habits to ensure the health of the public. Lastly, and here are the sources I used for my evidence and information. Thank you.